Hi, my name is Dr. Erick Jara, and I am going to talk about management of left heart failure. Common respiratory signs are tachypnea, increased rate of breathing, and increased work of breathing, non-specific signs of respiratory distress.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber.
Applications in medicine. Causes of acute heart failure, acute myocardial infarction, ischemia, acute mitral regurgitation, papillary muscle rupture, chordal rupture, arrhythmias, aortic dissection, cardiac tamponade, valve destruction, for example, endocarditis, myocarditis, flash pulmonary edema, renal artery stenosis, and pheochromocytoma.
While vasoconstriction helps maintain blood pressure, it can also have maladaptive effects. For example, the weakened heart must pump harder against increased resistance in the systemic arteries, while constriction of the coronary arteries further compromises the myocardium's supply of oxygen. Venous constriction also contributes to displacement of fluid into the lungs and other tissues.
Pros. The patient should be sitting upright and assessed by the ABCDE approach, check the patient's airway and administer high-flow oxygen through a reservoir bag, also known as trauma mask. B. Monitor the patient's breathing and look for evidence of fatigue. If concerns, then an urgent anesthetic ICU opinion should be sought. Pulse oximetry should be used. C. Assess the patient's circulation by measuring pulse and blood pressure and feeling their peripheries to check perfusion. The patient should be on a cardiac monitor to identify any arrhythmias. Insert an intravenous cannula.
In congestive heart failure, the heart muscle begins to lose its ability to pump efficiently, and not enough blood is ejected with each beat. The lack of oxygenated blood will cause dyspnea, tachycardia, and tachypnea.
Cons. Cardiogenic shock has a very high mortality, up to 90%, and the patient should be reassessed at regular intervals to identify evidence of developing shock, so that appropriate management can be initiated quickly.
In the liver and the spleen, causing abdominal edema. In left-sided failure, fluid backs up into the lungs, causing pulmonary edema, a life-threatening emergency. In addition to severe dyspnea, there may also be blood-tinged sputum.
Thanks.